Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
anti-serotonergic drugs. So first we have serotonergic drugs. First, non-selective drugs. Non-selective drugs are actually cyproheptadine. Cyproheptadine is an anorectic. It is an antihistaminic also. It is an anorectic and it is used in the prophylaxis of migraine. Then we have methotrexate. Methotrexate also has a similar use, but the important side effect of methotrexate is it can cause pulmonary, endocardial and retroperitoneal fibrosis is caused by methotrexate. Then we have lysergic acid drug, LSD diamine. Lysergic acid diamine, it is an ergot derivative, it is an hallucinogenic drug and it is a drug of abuse which is responsible for synesthesia. Then we have selective drugs. In the selective drugs, first it depends upon the receptors. Obviously, 5-HT1 agonists. First it is 5-HT1. 5-HT1 we have first agonists. In the agonists we have 5-HT1A agonist is repinotin. 5-HT1A agonist is repinotin. 5-HT1B 1D agonist is sumatriptan or all the triptans. Then antagonists are 5-HT1P antagonist. 5-HT1P antagonist is cisapride or mosapride or denzapride. Cisapride, mosapride and denzapride are 5-HT1P antagonist. Then 5-HT2, 5-HT2C agonist. Agonist is lorcaserin. Lorcaserin is 5-HT2C agonist. 5-HT2A antagonist. Antagonist is ketanserin. 5-HT2A antagonist is ketanserin. Then 5-HT3. 5-HT3 antagonists are ondansetron and also granisetron. Ondansetron and granisetron are 5-HT3 antagonists. 5-HT4 agonists. 5-HT4 agonists are metoclopramide. They are also cisapride. We have mosapride. Then renzapride are 5-HT4 and agonists. 5-HT4 agonists.
thank you and thank you for watching.